Hi guys, my name is Bree Janes. I'm the founder of Breaking Chains, the Whitney Project. So today I'm going to talk to you about people that are currently in active addiction and haven't gone to treatment yet and don't know if they want to go. So if you're a family member and you're struggling, I've had a lot of family members come to me and say, how do I talk to my sister, brother, mother, daughter about going to treatment? And they're very concerned, they're very worried. They definitely know that this person is using. They don't always know what. They don't always know what is going to help them. And this is really, really hard on them because they just want to see their loved one get better. You have to think, as a loved one of an addict, you watch somebody go from being their normal selves or the child that they were to this whole different person that is not even parallel to what they used to be. You may see little sparks of their personality show through. You may see like little things that they say seem the same, but it's almost like a zombie took over their body. And I know it sounds kind of extra sometimes, but all different types of drugs do different things, and this is going to give you some signs as well. So if you're wondering if your loved one is on drugs, I'm going to give you some hints or clues that I recognize myself, and hopefully you can take those and learn from them. So the first one, if you have a loved one that is doing uppers, now when I say uppers, that means like methamphetamine, cocaine, crack, that's super meth, things like that, coffee, Adderall, those are all uppers, okay? Adderall is a prescribed drug, but some people abuse it. It is one molecule away from being meth, but it doesn't really react the same way on the brain as meth, so don't get all freaked out if you're on it, think you're doing meth, you're not, but it's definitely abusable for somebody who doesn't need it. You see, for some people, there's a paradoxical effect on the brain, especially in children. So instead of reacting the way somebody who doesn't have ADD or ADHD does, when they take this medication, Adderall, it causes them to go down or have a downer-like effect or even like a stabilizing effect. So somebody who doesn't need this medication is going to be like off the wall or feeling really good or being full of energy that they really needed to get through the day, or so they think, but eventually it takes a toll on them. They become addicted to it, and then it ends up being a big fiasco where they can't really function without Adderall because that's what they're used to, and of course they are now kind of an addict, you know. Being addicted to anything without having a normal life is in fact addiction. You know, if you start to see yourself getting in trouble to maintain any type of addiction, then you have one, and it doesn't always mean that it's your fault. I know that many people got addicted to medications through the pharmaceutical companies. You know, their doctor put them on Adderall and they were on it for a very, very long time and they don't know how to function without it, as well as many other medications. Not all of these medications are narcotics. Some of them are SSRIs. Some of them are, like basically any anti-anxiety drugs. All these drugs do have side effects and can cause withdrawal symptoms. So, the thing about it is it's about being smart and, not going over that line for them and not buying them off the street and so forth. So how do you know if somebody is on like cocaine or Adderall? Well, for one, they're going to sniff a lot because they're probably sniffing the drug. I sniff a lot because I have allergies, but they're going to do that a lot, like rub their nose. I see that a lot in people that are high. They're always like itching, rubbing. That goes for like other drugs too that are downers. Their pupils will be giant. So like their pupils will be like 3 times the size of mine. They'll be big. Now there are some other medications that can do this. So don't just jump on them and be like, oh, your pupils look big, you're high. No, that doesn't necessarily mean they're high, but it definitely means that something's going on. Either their medication is doing it, they could have like a brain issue, you never know. But definitely upper medications and drugs, hard drugs, soft drugs, those will cause the pupils to grow and dilate. Another thing, okay, so cocaine can be injected. Some people don't sniff cocaine, so some people do shoot it with needles, and that's where you would look for track marks on their arms, in between their fingers, on their hands, neck, toes, inside of the leg, groin. They don't have to go in their arm, friends and family. So if your loved one is an ex-addict and they're showing you right here and you don't see anything, it doesn't mean they're not using. It just means that they're not using right there if they are. Now, they might not be using. You might be accusing them. Don't jump and accuse them, too, because sometimes you're wrong. Sometimes us addicts just act like shit sometimes. We don't act normal. And sometimes we go back to that thinking mentality when we are using. And it doesn't mean we're using. It just means we've had a little mental relapse in our character defects. And suddenly we're showing them a little more than usual. Doesn't mean it's going to last. Doesn't mean we're going to use. It just means, sometimes we are human. And we go through phases where we don't feel good and we're depressed and we have anxiety. Mental health definitely goes into this. So how do you know if this person is on uppers? Well, crack cocaine. Cocaine is a powdery white substance. I'm sure a lot of you know that. Usually it is in baggies. It can be like wrapped in plastic. I'm not super familiar with coke because I didn't do it that often when I was using, but I know a lot of people did, Sometimes it's prepackaged, sometimes it's not. It's usually a fine powder though. Let's see. Cocaine is like hard, or crack is hard. So crack cocaine is like the harder subject of that. It's a counterpart to it. So it is cocaine, but it's been like changed to be different. It's for, it's cheaper, I think. And it's for people that have kind of moved on to smoking that. Crack is usually smoked, but some people do shoot it. They break it down into vinegar or other, things that change the pH, and it causes it to become a liquid, and then they shoot it. It does happen. Crack is definitely a lot more addictive than cocaine. Cocaine's very, very addictive, but crack is a little worse. I've seen people sell their TVs go insane over crack. I've definitely seen people go insane over coke too, but crack is very, very scary. My own watching someone I love go through crack addiction over and over again over the course of like 3 years was terrible. And every time he'd quit, it was psychologically powerful. And he didn't really have a withdrawal from it, but it would be the mental withdrawal that would always get him. So that was definitely terrible to watch. The type of person he would, basically lose a lot of weight and just not be himself. So that's another thing. If somebody is using uppers, it speeds up the body. So if they're using any of those drugs, Adderall, crack, cocaine, meth, it will make you lose weight normally. Sometimes it doesn't, but for the most part, most people do. They're using it often. Their face will kind of start to look sunken in. They'll be talking really, really fast, like 50 miles a minute all the time. Kind of like thoughts are all over the place, kind of bouncing thought to thought, not really staying on a steady thought pattern. And that can happen to a normal person too, but like it'll seem a little excessive for their personality. You can definitely see these changes. Very, very focused on that, hyper vigilant, a little paranoid, especially with meth. So meth is a crystal. I guess it can be like a powder too. I'm not really sure on the looks of it because I haven't really seen it more than twice. I've seen it as little crystal things, put in like a vial or put in bags. And they either shoot it or they snort it or they smoke it. People that smoke meth will have sores all over their face. That's a huge thing. They'll have sores literally all over their face. It causes, the body to break out, and it'll kind of ooze out of the pores when one is detoxing from meth, and you'll see it on their body. They scratch, they pick. That's a big thing. People, they want to pick, so that can be the cause of the sores too sometimes. But yeah, so definitely look for, track marks. A lot of times the track marks are going to be a little different because of the fact that they're not really, meth isn't a good thing to really put in your body. It's not meant to go in the veins, so the veins tend to reject meth, so they could have a lot of abscesses because of the fact that it's sitting under the skin all that leftover filler. You got to think it's a lot of chemicals put together, so it's bad. Um, People on meth, oh God, I have such bad allergies. It's terrible. I always sound really nasally, and I hate it. I hate my voice. I know I shouldn't, but I do. But people on meth. So meth is a whole nother dimension for me. When I watched my friend do meth, he starts wiggling his arms all over the place, blah, 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 like that. He doesn't know what's going on. He's switching subjects like this constantly. It's not like one at a time. It's like all the time. He doesn't know what's going on. His pupils are the size of his eyes. He's always denying that he's not high. He's like running around and he's like sleeping. If he's doing heroin and meth together, then he's falling asleep and then jerking. He usually stays up for days when he's on it. So it's definitely not a good drug. He loses a lot of weight while doing it. His face becomes sunken in, he gets the sores. So yeah, that's like what I see with meth. So if you're looking for paraphernalia, straws, tinfoil, that's a big one. Needles, tins, vinegar, those are big ones, especially for the crack and cocaine. Yeah, definitely for that. Okay, so I'm going to move away from uppers. So I'm just going to let you know that there isn't the withdrawal from uppers like crack, cocaine, meth, and all that, Adderall, is not feeling good when you come off it. So, you don't feel like yourself. And the biggest thing to watch for with somebody who's coming off those drugs is depression and suicide. And I know that this isn't talked about much, but people that come off of cocaine are very suicidal. It's a very psychological drug. So they don't want to live. They feel very depressed. All those endorphins and hormones aren't being released anymore, and they do not want to live, and they usually get very, very out of their minds. So keep an eye on them. Keep them happy. Try to keep them a little bit stimulated after they rest. Let them sleep for a little while, a couple days, and then after that, get them going and doing things that they like. There are medications out there prescribed by a doctor that help with cocaine withdrawal, and it will help people to basically get through the withdrawals and the depression and the anxiety. They prescribe many different meds. You have to think most people that are coming off hard drugs have a problem anyways with their, depression and anxiety. I feel like I have a hair on my lip. I did. Yuck. So, I sound so nasally. I'm trying to get, my nose cleared so I don't sound so nasally. I don't think it's going to happen. But, yeah, so that's a big thing. Oh. All right, now we're going to talk about coffee. Coffee is very addictive. Stop drinking coffee. Actually, I'm really going to talk to you about coffee. If you're somebody who drinks a lot of energy drinks and coffee, I have PSVT, and it's a heart condition where my electrical impulses don't work. The SA node misfires, which is basically the first part of the electrical current that shoots off the, telling the heart basically to pump. And it likes to kind of circulate between these circuits instead of the whole thing. So it'll cause it to misfire to try to go, the heart's actually over here, but it'll cause it to misfire to try to go back into normal rhythm, therefore causing me to have this whole weird beat. It'll be skipping beats, and I'll be freaking out thinking I'm dying. Usually people don't die from it. Usually they end up with an ablation, but the number one thing you should not be doing with PSVT, proximal supraventricular ventricular tachycardia, is drinking coffee. Stay away from caffeine. So if you're somebody who has a lot of anxiety, it could be from the caffeine you're drinking. I know if you're in recovery, you like coffee, you like energy drinks, but energy drinks increase the risk of stroke by 300%. So you do not want to do that to yourself. If you are in recovery and you have survived addiction, do not give yourself another reason to die early. Just don't do it. Quit smoking cigarettes. Cigarettes are bad for you too. They increase your risk of stroke a lot. I don't know the exact number on that one. You don't want to have cancer. You want to try to be healthy. So if you're somebody in recovery, try to cut down your coffee intake to 1 to 2 cups a day. I work overnights, so I tend to drink a lot of coffee on overnights. Try to cut out cigarettes. I quit smoking and I feel a lot better. I really do. I didn't gain a lot of weight. I gained 4 pounds. So you can do it, I know that the weight thing scares people, but it's definitely worth it. If you have children, they want you to be here. Cigarettes is like nicotine in cigarettes is like one of the number one drugs. And if you are a smoker and you're not ready to quit, that's okay. I'm just glad you quit hard drugs. But if there comes a time that you feel like quitting, you can message me and we'll talk about it, okay? I sniffled again. And I'm drinking coffee. It's my first cup of the day, so. Okay, now we're going to go on to downers. There's a lot of different drugs out there. I'm not going to cover all of them. I'm just going to cover as many as I can. So if you think your loved one is on anything like heroin, Percocets, norcodone, oxycodone, Suboxone, methadone, all of those drugs, they all have kind of the same downer effect, but they all have different uses. So heroin is obviously illegal, and it's in the United States quite, often. It's everywhere. It's cheaper than all the other opiates. People usually end up on heroin because they start on pills. So usually what happens in a lot of cases is a doctor prescribes pills to a patient that has pain. So they either had surgery or they just have a lot of pain. So they ended up with like norcodones or Percocets. All of these pills have like the same effect, even Opanas, all of those. Fentanyl patches. And some are just stronger than others. So it causes the person to perceive pain differently. It doesn't actually do anything for the pain. Again, all it does is actually change how the person feels the pain. So instead of being in a lot of pain, it feels like they're not in a lot of pain because the brain has opiate receptors and it plugs all those opiate receptors. They're agonists, and that what they do is basically just cause you to feel pain differently. So a lot of these drugs cause like a euphoria, which makes people want to continue to use these drugs. They're very addictive. Some people take them and never get addicted. Some people, stay addicted for the rest of their life. I know there's a man that I've met, and he talks about, Vicodins quite often. And he's a very nice guy. You would never really assume that he was addicted to them. He was given them by a doctor, but he talks about them all the time. And we laugh about it, but I worry about him a lot. So another thing, pills, if somebody is using them, not recreationally, so they're not prescribed by a doctor, they're using them on their free time, or they're abusing the ones they get from a doctor. A lot of times they'll be snorting them, but you can still abuse them by taking them orally. Some people just take tons of them because their pain, now their body's tolerance has risen, and they need more to get by, and the doctor won't prescribe more. And some people just feel like they need more and take more because they're either upset or they're depressed or they have anxiety. You got to think these pills bring you down like 10 levels. So I have a brain that runs 50 miles a minute. So when I take drugs like that, like I used to, it used to bring me down. So as a teenager, that felt like a cure-all for my problems, you see. So that's how I ended up on opiates. So these people that are abusing them, they either snort them. If you're looking for paraphernalia, sometimes you'll see straws. Sometimes you'll see people will shoot pills sometimes, not very often because there's a lot of fillers in pills, but it does happen, like the bigger ones like Opanas and methadones. So, the morphines, they're covered, but people will actually take like a petty egg and shave it off. Like there's a lot of different things that people do, so it doesn't necessarily mean they're not taking them in other ways. Signs that they're on them, their pupils will be really small. Like mine actually are pretty small from my medication, but like they will get really tiny. Like they'll get tiny. So it'll be like you barely see their eyes. And other medications do this as well, but 9 out of 10 times it's opiates. So it could be from things like Suboxone and methadone too. So if somebody is on a maintenance program, it can be from that. If somebody has the Withdrawal shot, that'll do it too. Or the naltrexone, their pupils will get tiny because it is also covering the opiate receptors, but those do not get you high. So there is no high at all from those medications. Also, if somebody is abusing, now we're going to go on to higher drugs like fentanyl patches. Fentanyl patches can be smoked. So if you're finding like tinfoil, if you're finding straws, people do smoke those. There are the patches that like some people chew the patches. So like if you watch for that, they'll cut them up and chew them. Fentanyl is very scary. People have died from touching fentanyl. So if you know a loved one is doing fentanyl, they need to go to rehab. I know that they probably don't want to, but they should. The worst part is trying to get them in. So there is a really bad withdrawal from all of these things, but as you go stronger, it's harder to get off of. So the opiates, like the pills prescribed by doctors, the withdrawal is like a cold. As you do more, it gets more intense. You have leg spasms, pain, you can't sleep, you don't feel good, you might throw up, you might, have diarrhea, those types of things for like a week. As you move up to the patches, it's going to last a lot longer. It might be 2 weeks. It's a lot stronger. You may have really bad anxiety. Your heart's going to race. Your blood pressure is going to go up. Not going to feel very good, but you can get through it. It's usually not deadly at all unless you have a lot of other pre-existing conditions. And even then, most people are okay getting through the withdrawals. I had a withdrawal in jail from heroin, so I didn't really have a choice. I did get like 2 gabapentins while I was there that were given to me by a doctor. So, another thing. So fentanyl patches are very dangerous. Like I said, if somebody is using any of these drugs, they're probably going to lose weight. Some people gain weight, but most likely they're going to lose weight. They're going to start to look really unhealthy. They may develop sores from smoking as well. People on opiates pick as well. So that's a big thing. Now, if they're abusing heroin, there is fentanyl and heroin around here. It's mainly fentanyl. It's actually mainly not heroin. So if you're finding it, it's very dangerous. People that die from overdoses usually are fresh out of jail or fresh out of rehab. And if you're sending your loved one to rehab, I definitely guarantee that they need to be watched. Like, I guarantee they might do something stupid when they get out, and I hope they don't, and I hope they live, but, like, people that die, it's in those first couple of days after they get out of rehab or jail. So if you're a loved one, please stay with them for the first couple of weeks out of their place, because they don't realize that if they use in those couple of days, their body is not at the same limit where it was. And a lot of people go to rehab and think that their tolerance is going to go down, so they're going to get a lot higher, so they use after. Don't do it. If you're somebody watching this and you've been thinking of that, don't do it. It's really scary, and if you overdose and die, your family literally is going to miss you, and it can be you. You're going to destroy your family's lives. So please don't do it. Please don't. And, somebody does love you. If you feel like no one loves you, even if I don't even talk to you, I promise you someone does love you, and I will try to talk to you. It's just a lot of people try to take advantage of my time, and that's why it's really hard for me. So, we have to take care of ourselves too. So just please be very, very careful with that. Also, if somebody is on heroin, you're going to find needles, tins, cottons, tiny little tins. It could be anything. It could be like a water cap. It could be anything small that they can mix in. Spoons, burnt spoons on the bottom. Some people burn it. Little tiny cotton balls or pieces of cotton ripped off from your Q-tip tips in your bathroom, or cotton balls in your bathroom. People will use anything. They'll use like cigarette filters. So sometimes people will pull a cigarette filter out. Just be very careful. They will use anything to tie off. So it could be a string, could be a car seat belt. So remember, they can shoot up anywhere. Here, legs. Watch for abscesses. If they're going to the hospital for abscesses, they're probably using. It's a big thing. So people that are on opiates are going to act low. They're going to act down. They're going to be tired, possibly nodding out and looking like they're falling asleep. If you see them drop like this with their head to their chest, rub their sternum to check. And if rub right here really hard, extremely hard. And if they wake up, then they're okay. Count how many times they're breathing per minute. If they're breathing less than 10 times per minute, then they need to go to the hospital because they're probably overdosing or they're about to. Usually the overdose happens within the first 6 to 30 minutes, but it can happen right away too. So just keep doing this and see if they wake up, right? Now, if you're doing this and they're not waking up, then right now they probably call the emergency department right away. If you have Narcan, administer it. Now it's those spray things where you spray, you put it together you spray it in one nostril and the other nostril, and it should administer enough to wake them up. But now there's a lot of fillers and a lot of extra things in fentanyl, so they're not really like strong enough. So I would say if you have Narcan, get like 2 or 3 just in case. Give it a minute or two. If they don't wake up, do it again. The fentanyl is really, really strong out there. Just make sure you call the emergency department so they can take over. Now they're saying that to do CPR, you're not supposed to put your lips on a patient, but in this case, CPR should be administered. You want to keep the heart pumping and you want to keep the lungs inflated, because basically what's happening in this situation is somebody is losing oxygen. I'm not a doctor, so this is not, I am a nurse. I'm not a doctor. I am Narcan certified. But basically you want to keep their lungs filling up with air because their respiratory system has stopped. That's what's causing the problem. That's why they're unconscious, because they're not getting any oxygen. So I would personally continue giving them air, blowing air into their lungs. You can get those little barrier things to go over their mouth so you don't have to catch anything if you're worried about that. I mean, I wouldn't be, but some people are. That's a big thing. Just make sure you call the emergency department there and look up how to do CPR. I would hope that you would take a class. If you know that you have a loved one that is doing heroin, go ahead and get like Narcan certified, get Narcan, take a class from CPR. All those things are very important because you might have to do it one day. But we definitely want to keep air moving in and out of their lungs. That's a big thing. And their heart pumping. Their heart needs oxygen to continue moving and pumping blood through the body. So you don't want them to have brain damage either, because a lot of people end up with brain damage even if they do come back. And the first couple minutes are really vital in that process. So there are other opiates such as methadone and Suboxone. They are given to people that were on heroin to take care of cravings and withdrawals. Suboxone was meant to be like a 7-day taper, but they made it for long-term use in other cases for people that have addiction issues and won't stop using. So basically they put people on it for a year to like 5 years to take care of cravings as a safety net, but it is very addictive, and if you do not take it as prescribed, some people do abuse it. A lot of people that do abuse it, they get it off the streets, or the ones that don't, what they do is they save a couple of them and then use other drugs and wait till the end and basically take 1 or 2 so that it's in their urine. And then they go to their doctor, and their doctor thinks they're taking it long term, and then gives them another script, and they sell the script. Unfortunately, Suboxones go for a decent amount, and people will do that instead. And it's really, really scary because a lot of people think their family member are like doing good on Suboxone, but instead they're actually just selling them to get other drugs. And I'm not against it at all. I'm basically just against the pharmaceutical companies benefiting off our addictions that they cause. And I think that people that abuse the medication to get other drugs, that's not right either. But there is a way to, take them as prescribed. If a doctor gives you, 2 milligrams a day, it's probably not going to affect you. If you're somebody who hasn't been using opiates and you take one, you are going to get high off it. If you're somebody who's been on them or has been on opiates and you take it as prescribed by a doctor, you will not get high. You will not feel anything, and it'll feel like you're taking nothing, most likely. And it will definitely help with cravings, but the problem is when you want to come off of it, you need to go to detox or have somebody help you. Because if you try on your own, a lot of people do fail, and it's a really scary thing because people do end up relapsing if they're not careful. So if that's your option and you think you want to go that way, I'm glad that you're doing something to get clean, but be very, very careful because you have to understand abstinence is usually the best way to go. But if you think you're going to relapse or you can't go that way, that's okay too. We all have our own path. We're all in recovery for trying. So don't feel bad about yourself if you're not doing that. Methadone is a little different. Suboxone has a blocker in it. It's naltrexone, basically like the same thing as Narcan, but it doesn't work the same way. So if somebody takes an opiate and then goes on Suboxone within like 4 hours, they're probably going to go into precipitated withdrawal and become very ill. And they will go to like their sickest point as if they were withdrawing off that drug because the brain is ripping off all the opiates and replacing it with the Suboxone. If there isn't enough or it's not strong enough, it's basically just going to make it so the person gets very ill. So if you're switching from opiates to Suboxone to go on a program, wait at least 48 hours, I would say. For somebody who's on a lower dose opiate like pills like Percocet and Norcodone, you could probably get away with 12 to 24 hours, but I never could. So just be very careful. It's definitely a horrible experience going into precipitated withdrawal. But it's definitely worth it to get on a different drug that's not heroin or pills or these things, because those treat your brain differently. They're not long acting, and you're going to continue using and getting them off the street if you're not careful. So another thing, methadone does not have a blocker in it. You can take other drugs with it. That is why I disagree with it. I think it is good for some people that take it correctly, but if you don't take it correctly, you can literally do heroin, meth, any other drug with it at all, because it doesn't have a blocker. So people are more apt to overdose if they're not ready to get clean and they take methadone. Most people go to a clinic. They get driven by these drivers. There's a lot of driver schemes where these people are paying people to go to methadone clinics. So they're basically getting, a free amount of methadone. Then they're going and getting more drugs while the driver is actually driving them to get them. And this has been a big, scheme going on around here in this area that I've heard about. I don't know for certain because I've never been in them, but I hear people talk about it at times, and I think it's disgusting. And if you're a driver that is giving people that are in recovery drugs to go to methadone so you can make money, you are disgusting, and you need your own help right now, because you are hurting people that are vulnerable. These people need to get help, and so do you. So, it's going to come down. I see people getting investigated, so please just stop doing what you're doing and become a better person. It is not a way to get money. I know it's a quick way to get money, but it's not the right way, so stop. There is a normal job that you can do that will get you paid. Another thing, so outside of those drugs, there are things like benzodiazepines, like Xanax, Klonopins. Those are prescribed by a doctor. If you take them correctly, you should be okay, but they do have a very bad withdrawal. If you are trying to come off those drugs and you are on a decently large dose, or you just are afraid that you take too much, then I would suggest you definitely go to detox to come off them, because people have died from coming off of those drugs, as well as alcohol. And, they are very, very strong. They work on the GABA receptors in the brain, if I am correct. Don't quote me on that, but I'm pretty sure they do. And you have to be very, very careful with them. I know they make you feel good, but you probably have to take more over time. And I just would say that if you do not want to be on them anymore, talk to your doctor. If they help you, then stay on them if you're taking them correctly. If you're abusing them, I've met people that took 20, 40, 90 of them. They black out, they steal things, they don't know what's going on. Then they wake up the next day and they're like, what just happened? So if you're one of those people that is abusing them, getting them off the street, or you're doing things like that, it's really, really scary. I've had a friend die and overdose on them. Just be very, very careful. I suggest you go to rehab and get some help. I know that, you kind of want to make life go away and reality go away, but it's not worth it. People on benzos, some people gain weight. Like I said, a lot of people lose weight. When you mix them with alcohol or opiates, the chance of dying is very, very high. Some people mix them with gabapentin. The chances of overdosing and passing away very, very high. Like I said, mixing them is a big no-no. People also that, do these drugs, they tend to not know what's going on, and they're very out of it, and then the next day they're with it. So, that's something you might see. The withdrawal is pretty bad. You're going to be very anxious and feel bad, but if you're under the supervision of a doctor, they will give you something to help you, and you should be, okay, or at least somewhat comfortable. The last one I'm going to talk about is alcohol. Alcohol is a very, very, very tricky one because it's legal. It's everywhere. We can buy it on the street, but it definitely is one of those drugs that gets people hooked on other drugs. They drink, they're not in their normal state of mind, so they try other drugs and they get led down the road. It crosses the blood-brain barrier, so it affects our motor functions, therefore making us not able to drive cars or do things normally. It makes us different people. I definitely think alcohol is one of the scarier ones to me, because I've seen people change their entire life over it. And at the same time, they'll be completely normal. Then they start drinking. Now they're like, ooh, and they're just trying to escape. And I get that, but they're not themselves. Some people get really mean and abusive when they drink. Some people are very light and funny and have a great time, but then they start crying. I mean, it's really an emotional drug. It is a depressant. So if you take other drugs with it, it's a CNS depressant, and you can die. Definitely a very, very scary thing to be addicted to, I think, because it's so out there and legal and it's everywhere. And I don't want to see people think that just because it's legal, they can keep doing it, because you can live a totally happier life without it. So if you're an alcoholic and you think you drink a lot, even if you just drink on the weekends, but you're drinking a lot on the weekends, you probably are going through like a stage of alcoholism. And I'm not going to determine that for you, but if you know it's affecting your life and things aren't going the way that they should be, if you weren't drinking and you know that you're becoming unmanageable, I do suggest you stop, because you probably have children that love you, that want the real you back, and it's definitely not too late to do that. If your loved one is drinking a lot, I know it's hard, because it's hard to tell them they can't, because they're going to say, well, yes, I can, and everything. They're going to try to say, like, everything else is bad, and at least I'm not doing heroin. It's not a good argument. They need to stop. Alcohol can be very scary. If you're somebody who drinks, a glass of wine a night, I'm not talking to you. I'm talking to the person who drinks a lot every day. The come off, you can die from coming off alcohol. So I suggest you go to detox and rehab and let them wean you off of it. You can hallucinate, depression, anxiety kicks in. It's a really scary thing. So I definitely suggest that you get help for that as well. And people usually do gain weight, but some people also lose weight if all they do is drink. So it goes both ways. But I promise you can be happier. You don't want to end up with wet brain. People do end up with wet brain, and it's very scary. So that is the end of my video. I am not a doctor, so everything I've said is just from personal experience. So if you don't agree with me, that's okay. This is just my opinion and my experiences. I love you all. If you are trying to get a loved one to get an intervention or get clean, I did just watch a video on one of my friend's brothers. It's very good. His name is Kurt, and I'm very proud of him, and I really hope to see him do well. If you are somebody who wants to help your siblings or your mother or your father or your family, it's okay to schedule a little family intervention with them. They're not always going to say yes, but my best suggestion is to find a rehab you trust and see if they have open beds, so that if they say they want to go, you can actually get them in there, because doing the intervention and not having a place for them to go is just going to give them time to run off, and you don't want to do that. It's very hard. People have to hit rock bottom sometimes to get better, but other people can go even if they're not ready to go and get better too. So, you never know. You can't decide what is going to get somebody else clean or sober. You can't decide what event is going to work. So if you really want them to get help, be loving. Don't be condescending. Make sure to cut off certain ties. Don't let them take from you. Don't give them money. Just be honest and thorough with them. Draw boundaries. Tell them how you feel. And they're not going to like it at first, but if an addict is happy with you, it's probably because you're doing something that's enabling them. So enabling is real. Enabling kills. Love kills. And it's really hard, because we want to see them not in pain. We don't want to see them sick. So we'd rather give them the money sometimes to keep them happy, but don't do that. They need to suffer and understand that they can have a better life, and that this isn't the life they need to lead. But if they're constantly high and not withdrawing and living in this la-la land of insanity, they're not going to see that. Thank you for watching. I love you all. Today is my mother's birthday, and I just want to say happy birthday, Mom. You are the best mother anybody could have, and I'm so sorry that you had to lose your daughter to this disease, because it is insidious and it is everywhere. And my mom never did drugs. My mom never did anything. She was a very good person, naive, didn't understand, and she lost one of her daughters to a heroin overdose, and the other one almost died as well. I'm here though, and I'm alive, and I carry the message for my sister Whitney and myself and my mother, who, can't do that all the time. So I'm very, very thankful that I have a sober mother that didn't go through the things that I did. And I'm glad that I have a family, and that my father supports me and everyone else supports me. And I'm very, very thankful for that. So, you have to realize that you guys are what keeps me going. So thank you for watching. Please tell my mom happy birthday. And comment below if you know somebody that's struggling from addiction. Because, I know a lot of people think there isn't a lot out there, but there is a lot. So if you're in recovery, or you know somebody that is in recovery or active addiction, comment below what you think. Thank you.